Good afternoon, everyone. Welcome to the U.S. Chamber Foundation's Path Forward series. If you're just discovering us, welcome. We're delighted you joined us. And if you've been a regular, even more welcome. We're delighted to have you back. At the U.S. Chamber of Commerce and at the U.S. Chamber of Commerce Foundation, we know that we will only get back to our regular, normal lives, to economic health, when we get back to physical health. We know that we've got to get back to that strength and to that vitality as a country and back with our families and friends and back to work. And we're all just so eager to get there. And we're so close now, right? Because of this historic private sector effort to get vaccines and therapeutics into the hands of the people who need them so quickly, just so amazingly quickly and effectively. And so now the real question is, how do we turn vaccines into vaccinations? How do we get these vaccines into people? So the U.S. Chamber of Commerce has been working together with employers across the country. Our Rally for Recovery effort has been signed by hundreds of employers representing more than 4 million employees. And this is really just a commitment on behalf of employers to say, yes, I will do everything I can to encourage my employees to get vaccinated and to make it easy for them to do so. So they've committed to help not just their employees, but their customers and their whole communities, really, just so that we can get to the other side of this. As you know, as you're all reading and thinking about, and business leaders here that have signed the commitment are also worrying about, which is, okay, I can commit to that, but what about vaccine hesitancy? What do we do to combat that and to really get people to decide that it's in their best interest to get vaccinated? So today we have a terrific lineup of speakers. Their organizations have been vaccinating their staff for months, and I think they have some lessons that'll help the rest of us get through this. So we're delighted today to be joined by Dr. Susan Garfield, who's Ernst & Young's America's Chief Public Health Officer. Also joining us is Dr. Nicole Schaefer, who is the Senior Director of Colleague Wellness at Pfizer. And finally, we're pleased to welcome Tina Sandry, the CEO of Forest Hills of DC. So we're going to get bad diversity marks today because we have no men on our panel, but we'll take it. We'll take an all-female panel today. So look, we're going to get started with Dr. Susan Garfield. We have a lot of questions. Please keep putting your questions into the chat so we can get to them at the end. And Dr. Garfield, welcome. Would you please start with giving us your assessment of where things stand right now with the pandemic?
Yeah, it's such a pivotal time, Suzanne, and thank you for having me with this wonderful group of people. Employers around the country are trying to figure out how they can be advocates for vaccination, as you pointed out, how they can leverage their unique role as participants, leaders in their communities, and trusted sources of information among their employees to help educate as well as advocate for vaccination. And you touched on the critical challenge around vaccine hesitancy, and employers have a really big role to play, not only in helping their employees understand the specifics around what vaccination is, but providing access to vaccination, in some cases incentives to get vaccinated so that they can help overcome any hurdles for those who are on the fence about getting vaccinated. Of course, in the beginning, this was focused on our highest risk communities, our minority populations, and now overcoming vaccine hesitancy has really shifted to a broader part of the population, those with political distrust of vaccines, those who just feel like they're healthy and might not need it, or those who just kind of aren't prioritizing it in their day-to-day lives. So our employers are standing up and saying, we're ready to become advocates for vaccination, and how can we be active participants in driving it forward.
Let me broaden the conversation for just a second. A few weeks ago on this program, we talked about disease X. We talked about what are we learning in this pandemic that could help us fight a future pandemic. But let me ask you, how would you grade how prepared were we, for this pandemic? And do you think we're learning enough that we could have a maybe more efficient or productive response to disease X?
Yeah, it's a great question. We, as a public health community, this isn't new. We've been responding to infectious disease issues for many, many years. And the response to COVID wasn't too much different. We contact trace, we identify interventions, we try to reach those populations most at need. What was different this time was the massive scale of the challenge. And what COVID did is it didn't break the public health system, it exposed all the cracks that were already inherent in it because of decades of underfunding. So what we're hoping for as we prepare for what's next, as we create more resilient systems, both inside government and outside, is that we properly fund those infrastructure issues like data, like rapid response, like surveillance, like a public health workforce, and like in a private sector who is more educated about the key issues around rapid response to public health crises and are already working collaboratively with governments, each others, and the communities within which they operate, so that should something happen again, we're all more collectively prepared and ready to work together.
You know, both that answer and an earlier answer reminded me of some of the politics we've seen in overcoming this pandemic. We saw it with masks. Now we're seeing it with vaccines. And getting to the point, I think, of your second question in terms of, or answer in terms of preparedness, what does this mean about the health literacy or even the science literacy of Americans in terms of understanding what evidence means, what science means? You know, how can we help people be more literate about their health and think of it less as a political issue?
Yeah, it's a great question. I think we often think about health literacy as helping people to understand the positive behaviors they should incorporate into their lives to create health. But I think what the pandemic has shown us is it's equally as important for people to understand risk. And our literacy around risk comprehension is very, very low in this country. So when we look at everything from people's responses to social distances and mask wearing and what it means when the incidence of COVID is high in a community versus low, and the relative risk to individuals versus others, I think there's a lot of work to do to understand risk and relative risk. I think another aspect of health literacy that's really critical for people to understand is from a public health standpoint, from the health of populations, we need folks to start thinking outside their own selves and look at the impact that their own behavior can have on others. So as we start to talk more about vaccination, the wrong way to think about vaccination is it's just about me. I want to get vaccinated to protect myself. The reality of vaccination is it's one of our strongest social contracts in the context of healthcare. And me getting vaccinated, especially as a relatively healthy person, is not only protecting me, my family, and my community, but it's particularly protecting those most vulnerable around us, those with underlying health conditions or immunocompromised or pregnant or otherwise. So I would encourage all of us to think about that. And I think employers and corporate citizens are doing a great job of reminding people that it's not just an individual action of positivity, it's really a collective embrace of the public good of public health more generally when you get vaccinated.
Do you see that last argument about I love that idea that vaccination is a social contract. Do you see that argument about a public good, a social contract, impacting young people who seem to be one of the groups that are vaccine hesitant?
Yeah, it's something as public health educators we've always tried to bring into the story. Again, you know, COVID vaccines aren't the public health community's first rodeo, and I think when you look at the most successful vaccination campaigns, they do have a dimension of communal responsibility towards them. But people who think of themselves as healthy and don't necessarily see the impact to themselves of doing something, they're always the hardest to reach. They're the hardest to reach with vaccination, with other routine preventive health services. So Lots of education is needed, lots of leveraging our new tools for digital engagement, personalized engagement, targeted interventions. We need everyone to work together. So this isn't about just the public health community or just government or just clinicians. It's also about all those trusted voices in the community coming together, including employers, including people who look and sound and feel like the populations they're trying to target, making sure we have adequate and loud and positive representation from all our communities of color, our underrepresented minorities. We have in-language conversations, whether Spanish or other critical languages around our nation. So the depth and diversity of advocacy is also a critical part of changing hearts and minds, especially of those who are hesitant.
As you think about communities of color and the real disparate impact on people of color that COVID-19 has had, what does it tell you about what our country's long-term response to disparate healthcare should be? If you think about ensuring greater access, greater equity and access to healthcare and thinking about health outcomes, where do you see us headed?
Well, I'm an optimist, but it's hard right now. Of course, we have a tremendous reality of social health and economic disparity in this country that COVID has brought to the forefront. I think people have seen it with their own eyes in ways that they might not have been so aware of it in the past. But the health disparities are not a single thing. They're the outcome of so many different factors coming together that are really difficult to solve and must be considered together as a joint priority of government, the private sector, individuals, communities. So making sure people have adequate and healthy places to live, making sure nutritional opportunities are close to their homes, making sure people have economic opportunities to make sure that they have not only good, solid jobs, but enough time to have recreation and positive lifestyles, access to high quality medical care, preventive services, interventions that are directed to their own individual healthcare needs, and of course, a public health system that can respond when there's a threat that is more generalized, whether it's infectious disease or otherwise. So the health disparities we're seeing in COVID are a sad reflection of a system that's embedded this type of inequity over generations. This isn't over years or even decades. It's a generational challenge that we're trying to unpack and overcome. And I can see so many different stakeholders around the ecosystem, private sector, public sector, recognizing it, prioritizing it, funding it, and starting to think about how we can work together to solve some of these issues. But it's not simple, and it's not something that anyone's going to do on their own. It's going to take all of the ingenuity of the private sector, all of the technology coming out of some of the leading edge thinking, and all of the intellect and heart and mind coming out of both our academic institutions and government to address some of these challenges.
I really appreciate that answer, in part because it's something we talk about a lot when we say at the Chamber, we know what a job means to a family and to a community. We know what it means to health outcomes, right? That's a piece of it. So thank you so much. We're going to have a lot of questions for you, I'm sure, from the audience, but let me for a minute bring in Dr. Nicole Schaefer of Pfizer. A lot of employers are trying to figure out what it would look like to have a vaccine clinic, that when there are enough doses available, that they can be part of the distribution process, what it would look like. And so given your experience, could you tell us what the biggest lessons have been in vaccinating your own employees?
Sure. Thank you, Suzanne, first of all, for having me today. Yes, it's been unique. The first thing is that it's not as simple as companies may have done flu vaccine clinics and other types of vaccination programs. There are more steps that are involved in the COVID vaccine process. And again, I will speak specifically to the Pfizer one, of course, but between the mixing and diluting, the drawing up from a multi-dose vial, and then administering, and then needing to monitor the person who's been vaccinated for at least 15 minutes after the vaccination. Add on top of that, that Pfizer and Moderna are both 2-dose vaccinations. So there's a lot of follow-up and a lot of coordination of effort that need to happen in order to make it go smoothly. So we've learned that you need to plan. You also need to have a better understanding of what your employment group looks like. What are there? How many want the vaccine? You don't want to plan that 100% want the vaccine if in fact only 50%. And so one of the things we've been very careful about is making sure that we're not wasting doses. So we plan very meticulously how many doses are at a clinic per day and what that needs to look like.
So there's so much there. Now I have like 100 questions. So let me try to get my head organized for a minute. I guess where I want to go first is we were talking about vaccine hesitancy. What does an employer do about how do you encourage your workers to do it without seeming like you're forcing them to? What's the line there?
And that's the first good point, is that an important point. We are not requiring our employees or contractors to be vaccinated in order to work in our workplace. So again, I've had that question a lot because we do manufacture it, and shouldn't we, as the manufacturer of the vaccine that we trust and we believe in the science for, shouldn't we require it? And we've said no. That is not who we are as an employer. We encourage and educate. I think education, and Dr. Garfield also talked about that. Education is super important. And we started even back prior to the holidays thinking that if people were going to get together with family members, even though we were not encouraging that they had some basic tools for educating family members when the questions came up around the table. So understanding the science. Again, we didn't go into 50 pages worth of every detail on mRNA and what the science was, but we did provide some basic points to be able to help colleagues and their families to better understand the vaccine, what it does, how it operates, how it functions in your body, but we also provide them with the risk factors. And we are the first groups to say, please go talk to your healthcare provider to determine if this is the right choice for you. So we are very much about choice. Yes, we've had some locations throughout the US and in other countries, because while I know we are talking in the US group, I'm also in the process of launching an additional 30 other countries right now, and we have about 9 countries that have already gone live with vaccination. So we have a lot of different rules and a lot of different questions that come out of that as well. But in the US specifically, when you look at different areas of the country, different populations, there are some groups that are more hesitant than others. We've not pushed that any further than providing them with the tools and education to make their decision the best decision that's right for them.
So as an employer, then, as we all are thinking about getting back to work, more of a normal work life, whatever that means, on the other side, do you feel that now that you can vaccinate your employees, that you're getting back to more standard time in the office, or is it still complicated by people who don't want to get vaccinated?
So complicated, yes, but it's also given us as a company a time to reflect and look at what is our company going to look like from an office environment standpoint. Remembering that in the US alone, we had about 30,000 essential workers that continued to work day in and day out through the pandemic, whether they were research and development team members, whether they were manufacturing team members. So those colleagues all continued to work on site. We had done a fantastic job of keeping our workforce that was on site safe with all the preventative factors that we had in place, whether it be masking, the marking of the floor for 6 feet distance, just all of those other preventative pieces. I think the key learning is do not come to work if you're not feeling well. And I will be the first to admit there were years where, I'd have a sniffle or didn't feel well, but I was hauling myself off to the office and taking care of others when I probably shouldn't have been there. So that's one of the big learnings that we've had as well. And we want to continue to have that. So the office look or the workplace look going forward, whether it be our field sales colleagues, our office workers, travel, all of those are being re-looked at. And what does it look like going forward? One of the programs we're putting into place is called Log In for Your Day, where you're not expected to be in the office 5 days a week. Come into the office when it's appropriate for you to do that. If that's 2 days a week and you can work the rest of your time effectively from home, then do so. And so, we've all had to look very differently at what the world's going to look like. Because we're not requiring vaccination, that means that we will continue to maintain those same preventative factors that we have had in place for over a year going forward. I don't know when we'll stop masking or if. I don't know when we'll stop distancing or allowing not to have more than one person in what was a shared office. So those are all things that will continue to potentially look different as we continue to go forward. Too early in the game to say what that is going to eventually look like. But right now, because we do have both vaccinated and unvaccinated, we still are keeping those social practices and preventative practices in place. Also remembering that the vaccine, yes, it's 95% effective, but that doesn't mean that someone, at this point, we don't have all of the data that says someone cannot get or transmit the virus. So we still need to make sure everybody is safe.
So smart. So much to unpack there too, right? As we're all thinking about how we return to work, when we return to work. Are any of us ever traveling again without wearing a mask? How has this permanently changed our lives? Question for you about new hires. So are you offering vaccines to new hires as well as part of an onboarding?
We are. So in 14 of our largest locations around the US, we have on-site clinics. So on-site clinical staff, nurse practitioners, nurses, physicians assistants that are Pfizer colleagues, and we are going to continue to offer vaccinations. That also allows for anyone who may have been hesitant early on and decide they want the vaccine, they can also come to the clinics to have those vaccinations taken care of. For those that are not at a location, they may go to a local pharmacy or other mechanisms, but we will help them to be able to find a place to get vaccinated.
That's so interesting. I hadn't thought about it till you said it, that you have kind of round one of offering the vaccine, and then you may later have employees get, more used to the idea of getting vaccinated and pony up. Are you seeing a fair amount of that?
We're seeing some, and the reason it's hard for me to answer fully, we've rolled this out in phases. Starting in January, we vaccinated site essential workers. So those were the ones that, like I had mentioned, the 30,000 that have been on site. Then we went to a next phase in March, end of February, beginning of March, where it was all colleagues were offered, regardless of whether they were working remotely. And we've since gone to the family or household members of those colleagues. So we have some colleagues that may not have gotten it initially as essential, but came in the second phase, or even when their family was able to come be vaccinated. So I don't have a good sense at the moment, but we are seeing some that are now saying, hey, I really would like to get vaccinated. And how we've been doing it, the easiest way for our clinics internally to manage that is just blocking a couple hours of a week every 3 weeks, because our vaccine, the doses are every 3 weeks. So that way you can have people starting dose 1 and doing dose 2 all in those same time frames. And so we just have booked out those times in our clinics every 3 weeks, at least now until the end of September.
Let me ask you a quick question before we bring in our third panelist. And it is something I like to ask everyone, which is, this has been a tragic time for so many American families, for so many small business owners. It's been a time of great disruption, as we were just talking about, culturally. But I do like to ask people what makes them optimistic. So from where you sit right now, what makes you optimistic about our future? So
while there is vaccine hesitancy, there are a lot of people that are taking the vaccine. There are people that are understanding the science. And I want to focus on that, getting people to really see that big picture, see how it does impact, very much building on what Dr. Garfield said. How do we help people to understand the impact socially, and allowing for families to reunite? And I think it's the mental health part of that is so exciting. And for us, Pfizer, for me individually, the science is huge. And the science and where we have come in a short period of time and where we can continue to go in the future is hugely optimistic for me, not just in the realm of COVID, but in many other diseases going forward.
I love that answer. Thank you for that. Let me bring in our final panelist, Tina Sandry, who's the CEO of Forest Hills of DC. I'm really interested to talk to you because you had kind of an early experience with this, where you run this large nursing home and you were able to vaccinate your employees in December. And so, how did that go? What happened?
We actually got our first dose at the top of January because our clinic had to reschedule. But we ran 4 clinics now to start, and we had at the beginning of January, beginning of February, beginning of March, and we went from as low as 50% up to we're now past 80% of our workforce having been vaccinated. And we've had a workforce with 87% people of color, known to be the second largest vaccine hesitant group. So we're very pleased with our results right now.
So, as I understand your story, you really worked double time to help your people think through this decision, the vaccine hesitancy that we've been talking about on this program. Can you talk to us about how those conversations went?
Sure. Our vaccine program started with a conversation with leadership. We really wanted to understand, even though EEOC had said that we were able to mandate the vaccine as of the end of December, we had a conversation and said, what do we want to do as a team? And we felt that our essential healthcare workers who had covered for so many of their peers due to quarantine or getting COVID, or someone else in the family got sick, or homeschooling and demands that happened at the last minute, as well as sometimes having to be the hand that held someone at the end of life because the families weren't able to come in regardless of COVID or not. These are staff who weren't necessarily trained to always do that. And COVID has forced other kinds of demands on folks. There's been a shortage of healthcare workers. It's pretty well known in the press because of the need for people to quarantine and be out of the workforce for a period of time in unannounced timeframes. So we felt with all these things going on top of the weekly testing with swabs, sometimes a nasopharyngeal swab often, and having to come in on your day off, even if it's your day off to swab, because that's condition of work, is we have to be able to monitor the virus. So people were coming in mostly when at work, but also outside of work to get swabbed. We felt that also mandating an emergency use authorization, substance that people weren't so familiar with and ready with, and said, hey, you're front of the line, it's time to go, just was not consistent with our corporate values of compassion and respect that we apply to our workforce. Also, as a healthcare institution, we apply the principles of trauma-informed care, and certainly COVID on a global scale has been traumatic for many people. And we don't always know who is suffering from trauma, whether it's the family member or our own employees. And so having this more compassionate approach seemed more consistent with a trauma-informed care approach, which every organization can take, certainly during this time. And so we decided to make it a voluntary program. And as Dr. Garfield was talking about health literacy earlier, our focus was not less necessarily saying we have to hit herd immunity, we have to hit 75%, or anything like that. It was more like, let's have a conversation so you understand what's going on. And from December, we took the approach of using weekly communications out to our workforce to talk about things like what is efficacy, what is effectiveness, what is messenger RNA, what is warp speed, how did it get made so quickly, what's inside it, what is herd immunity. We talked about past atrocities and put them on the table of Tuskegee and Henrietta Lacks, because most of our workforce is African American or African. We talked about immune response and what is that? What is a trial size and how was it different this time? And we talked about the fact that many of our workforce aren't necessarily the kind of folks who are out there getting the newest iPhone or the front of the curve of innovators in various areas. And sometimes some of our staff were actually looking for their peers. And we said, honestly, a lot of your peers aren't going to get the vaccine for 3-4 months because you're kind of top of the food chain as an essential healthcare worker. And that, like it or not, whether you choose to be vaccinated or not, you are the leader amongst your peer group, in your family, and in many of your networks. So without interjecting politics, we really helped to boost the literacy of our entire staff at all levels to understand what were the terms that were being discussed, so then people could go to various media sources and make informed decisions. And we took the approach of, as Dr. Shaper was saying, educational, very, very strong educational approach of knowledge is power, get educated so you can make a choice as to what's good for you and your family rather than having it done for you.
You know, that sounds so simple, but it isn't. I mean, it's such a sophisticated thing to do, to break down these scientific terms and really help people understand them and increase their literacy at that same time. I really applaud you for that. And I know a number of the employers listening are probably trying to learn from it and think about how they would do it. And so let me ask you a question, which is, how did you get that information? If you're talking to another employer on this right now who just basically wants to copy your newsletters, how would they go about writing them? How did you do that?
Well, I'd say, first of all, know your audience. As everyone who writes a newsletter has to know your audience. So we know that our workforce here was 87% people of color, most of them African American, and some of them African. So we wanted to have messaging coming out from people who looked and sounded like our workforce. So we found messages from Tyler Perry. We found scientific information as well. We also have done leadership training within our teams to look at folks and what their learning styles are. So we might have someone who's a more analytical person, and they would need to have more information about trial sizes and how they were done. Give me some data points. What is percent 94% efficacy, and exactly what does that mean? It doesn't mean that 6% don't get it. It means mild to moderate to severe, to death impacts, and how those are felt along the different ways with different types of vaccines. And so we looked at that. We also looked at folks who were more relational. And those kinds of conversations looked more like, have you thought about the vaccine? Have you thought about what it would mean to your health, your family's health? And do you know anyone who's in your close circle who's immune compromised? And what would it mean working here if you were to by accident carry home a virus or get it along the pathway, if you're taking the bus home on the way to getting home? And so we would have those kinds of conversations. We would also look at messaging out. Our team likes to say 8 ways to communicate. So if it was important enough, like I said, the themes that we kind of went with each week, it was important enough to say, we would find 8 ways to say it. So we would try to push that message out by email, by texting, by phone calls, by posters, by flyers and handouts at the check-in area, the COVID check-in area. We might have videos that we're showing in the day room areas. We would have little slips of paper that we cut up that people could take home with them. I literally helped many employees pull up webinars, speaking things, sources that we found on YouTube that were easy to understand. Messenger RNA is a very difficult concept to explain to someone who doesn't have a science background. And in the end, I kind of went with, well, if you bake a loaf of bread and, you think about having to isolate the protein, that would be the egg in the bread. And they kind of went, yeah. And, the recipe is sort of like the messenger that kind of tells you how to make this bread, and know that if you just isolate the protein, the egg, you're not going to get a loaf of bread. And so that sort of helped some of our employees understand that isolating the COVID spike protein was not the same as putting COVID into your arm, because that was a really difficult concept for a lot of our employees to get. And I think that was probably one of the most absolute difficult things to explain to people, and how that was different. And when you talk about the different audience types, it's well known, culture eats strategy. So if your strategy is to hit herd immunity, you better understand the culture that you're in. And for us, as we were moving along the various clinics, what we found was we were able to actually move the needle with our African American folks who identify as Black American, because there were enough role models out there through the Black Coalition for COVID, through Black Nurses Association, through the historically Black colleges and universities. And all I'm saying could be easily translated to a different cultural group. But we found that there weren't enough leaders in the African area. And so we, to this day, are still looking for leaders in those particular areas to help us with the message, to bring those folks in that subset along. And what we've learned is that going along the check marks of Caucasian, Asian, Black, and so forth is not enough. You have to break it down even further. If we look at our Caucasian Americans that live in the North, live in the South, separated by political party or so forth, we're all very different. And it's the same thing within our ethnic and racial categories as well. I'm Chinese, but I might need a different message than someone who is Eastern Indian, also an Asian. And so I would suggest that employers kind of take a look at your workforce, break it down. And as you're going through these clinics, we too offered multiple clinics. We've had 4 clinics. We would do a plan, do, study, act cycle in terms of quality improvement. So we would make a plan, have the logistics on how's the pharmacy working, what's the flow, are we confirming, communicating, the spacing and so forth. And we would have live data analysis after the clinics of this one, we had so many people sign up for dose 1, so many for dose 2, this many showed, we're now at this % vaccinated, and keeping a close tab on who's in the 0 column, who hasn't signed up yet for a vaccine and really doesn't care to sign up yet. And from there, we were sort of listening really hard to find out what their concerns were. And it really got down to the point where some of them were one-on-one conversations. We were dividing up the department heads, saying, who knows this staff person? Would you like to go have a conversation with them and find out what their concerns are? So it was really applying a person-centered care approach to our folks. For the employers out there that are healthcare-based entities, or if you've ever had a loved one in a hospital or a nursing home setting, you would understand that the healthcare provider tries very hard to meet that person's personal rehab, medication, and care goals. And so we listened really hard and tried to provide person-centered messaging out there to folks. And it came through lots of different ways. YouTube's a good one. If you find these credible sources, often have material out there that's accessible to people.
There's so much there. Again, there's so much there to unpack, but let me ask you a specific question. I'm sorry if I'm just not getting this, but my question is about privacy. I think there are a lot of employers who aren't sure how to ask people if they've been vaccinated, why, if they haven't, et cetera. So were you worried about that, or did you feel because of the EEOC conversation that you weren't going to get in trouble for singling out somebody and having a conversation with them about their choices?
Well, EEOC did say back in December that we as employers had the ability to mandate the vaccine. So when we were messaging out initially to our employees, we did explain to them very intentionally that we had a conversation within leadership and decided we chose not to pursue that out of compassion and respect for our workforce. And so here's where we are. We would like you to be informed and make an educated choice. So the fact that we as employers were able to mandate, right or wrong de facto, kind of meant that we had a right to know their vaccine status. Either they were or not vaccinated. And also we're a healthcare entity, and in being able to care for our residents, it's fair game for us to ask if someone has a contagious condition that they're bringing into the office. And now we all are used to being COVID screened in many of the environments that we enter today. So we have had criticism about, well, it's people's HIPAA status. Well, in healthcare, there is an exception during COVID that allows us to waive HIPAA rights in order to reveal COVID status. So vaccination status isn't exactly the same, but it is related to public safety. And so I think in the interest of public safety, it is kind of more fair game. And we felt very comfortable having that conversation with our workforce. We do not mandate it for visitors coming in, and we don't ask for it, but I will tell you, almost all of them come in saying, I've got my COVID card. Can I see my mom now? So I think people, at least those who are very happy that they've gotten their COVID shot, are really kind of ecstatic that they've got their shot, and happy to share that.
So let me ask you a question before we bring everybody back and run through. We have a lot of audience questions. Let me ask you the same question I asked the last panelist, which is, what makes you optimistic, having been through this? What makes you optimistic about the future?
I'm optimistic in my small world that we've hit herd immunity with a voluntary program, with a workforce of 87% people of color. And if we can do it, so can you. We've had our challenge. We've invested leadership time. It would have been a lot quicker for me to write a memo saying, we're mandating this and you have 3 months to get it done. But instead, our entire leadership team was engaged. I felt that it had the benefit not just of addressing COVID issues, but it's well known that there's a healthcare workforce shortage that existed well before COVID, and it will exist well beyond COVID. And I felt like this was an opportunity for us to engage our workforce in a way for them to understand in a deeply rooted, relevant, timely manner that we really care for you, and we're going to respect what you have to say and what you have to think about the situation, and your thoughts matter here. So I'm optimistic that we came out of that on a very positive side. Life is resilient, and as a community, and I'm hopeful that as a country, using the principles of growth mindset, that as we know better, we do better.
I love that. That was really helpful. Thank you for that. So let me bring all of our panelists back so that we might run through what are really a lot of questions here. So as you all come back on the screen, let me start, Dr. Schaefer, with you, which is, we had an audience question that said, you mentioned vaccinating employees in lots of different countries. And the question that came up was, is it different? Are there different approaches, both based on different legal and regulatory schemes, but also cultures?
So yes, there are a lot of differences, and that's probably what makes it the most challenging. So we have to involve our legal teams and medical affairs for each country to make sure that we've gotten the full or appropriate Ministry of Health, Board of Health approvals to be able to move forward. And we're also looking at what the population is that we're vaccinating. So are we vaccinating just our essential workers, our on-site essentials? Are we offering vaccination to all workers, or all workers and family members? So, we've really taken a very different approach, and it all depends on a lot of the political structure of what's happening in that country. There are definitely also cultural pieces to this. So Italy, when Italy went live with their vaccination program, Italy was one of our first markets that was hit very hard a year ago. And so there was a lot of interest, and they were just so thrilled to be able to vaccinate. So the excitement there was fantastic. Belgium, that is the other location where we make the vaccine. So they were super excited and had unbelievable amounts of uptake of over 90% of their workforce that participated in the vaccination. And then you have other markets where vaccination is not something that they deal with a lot, and they are still trying to understand why we should be giving the vaccine or what that could look like. Or markets where our vaccine, the Pfizer vaccine, is not the prominent vaccine. It may have approval in that market. We've not gone live in any market that there isn't approval, but even with the approval, that may not be the most prevalent vaccine in that country. And then it's the education of, and actually going back and forth where people want to wait for our vaccine versus whatever the government is offering. And so our message continues to be that we just encourage everybody to be vaccinated. So, don't wait. There's a health risk to waiting. So if that means you end up with the whatever the government vaccination program vaccine is, then so be it. But we want you to be vaccinated. So we have to look at every different market very differently. Again, the education is super important. We provide that in all the languages we possibly can. And that's where we also have clinicians sitting in a lot of those markets. So we utilize our internal staff that we have on the ground to be able to help us navigate through.
Very helpful. Thank you for that. Dr. Garfield, we have a question for you, which is, how do you think this has permanently changed our lives?
In so many different ways. This is a deeply personal experience for many who've lost loved ones, family members, people they know in their community, people they know who they work with. So I always start with, we need to remember clearly that everyone's gone through this differently. Some it's been a really minor disturbance. Others it's had a profound personal experience. I think as organizations, employers, thought leaders, people participating in future change roles like government and otherwise, I think it's changed us all because the interconnection of our society has never been more clear. And the fact that a little virus can cause such massive disruption to our economy, to our social structure, to our families, to our communities, that will change us all forever. And you asked what makes us hopeful. I'm tremendously hopeful that insight and experience starts to infiltrate into how we plan and invest moving forward. So because we've had this collective experience, I think it makes us all more empathetic to the role of health as a central driving force to both happiness, but also economic and social outcomes. I think it makes us all more driven in our advocacy to make sure we have interconnected solutions to drive more positive and equitable healthcare outcomes. I think it makes us more participatory in our engagement with both our communities, but those who kind of look and feel like us, but also those who are less well served and underrepresented, and hopefully gets more of us out there fighting for health equity, social justice, and other things. So I think it changes us generally, and I think for employers specifically, we're seeing a much stronger recognition of health on the priority list. The health of their employees, the wellness of their employees is something that they're looking to prioritize and invest in moving forward and very proactively.
I thought that was a really important answer, and I want to ask Tina to follow up on a piece of it, which is, as you think about how this has permanently changed our lives, specifically thinking about masks or social distancing, or do you imagine that even post this pandemic, post everybody being in a herd immunity state, that there are some of these practices you might retain?
I think it's interesting because in the end, we're a family. We're about a family business. When we work in the field of aging services, it's somebody's mom, dad, aunt, uncle, brother, sister. And much of this discussion has been in the context of business practice because this is the Chamber of Commerce. But in my business, it's really about family. And sometimes it's end of life with family. And so under compassionate care, even throughout the pandemic, we've been able to have exception to allow, even when most of the nursing homes were closed to visitors, end of life visits still were able to be happening. And they did have to have masks and full PPE at some points, depending on what the condition of the particular resident was. I think from a personal standpoint, it's interesting because at the start of the pandemic, I had dropped my son off in first semester of study. And when I got there, it was very interesting to see the stickers on the ground that were social distanced, the fashion designed masks that were available at the equivalent of 7-Eleven. And to someone like me who had never seen that, it was really very interesting. And my son, who had been in Japan before, said, oh, these are just leftovers from previous instance. And the culture had not let all of it go. So the masking had taken on more of a cultural, social side, but in the end still serves a scientific helpfulness of preventing spreading germs and illness. And I think there's a certain amount of infection control practice that's here to stay. I don't see stores and other places taking away the hand sanitizer. I think the masking will probably stay optional for quite a few people. And it'll be interesting to see. Right now in senior living, just this week, our local Department of Health has now said that family members coming in don't have to wear face shields on top of the face masks to come visit our residents. So I think we're going to see some stepping back on that, but I don't think it'll be a surprise to see a certain part of our society that is going to still hang on to some of those practices for health.
You know, Tina, when you talked earlier, you were talking about how you explained the science to people. And one of our audience questions is doubling down on that and asking Dr. Schaefer, you know, what should employers say to their customers or to their employees when they ask, isn't this science kind of experimental or early? What's a good answer to that to reassure people?
Colleagues. So that is something that we've had to continue to look at. How do you explain that? I do think that there are good tools that are on the CDC website that both have information for patients as well as information for healthcare providers. So the toolkits that are out there have a lot of good information to be able to utilize to help with those various audiences. It is a newer science, but quite honestly, Pfizer has been partnering with BioNTech for the past several years with that technology. So it is newer, but it's not brand new. It's not something that hasn't been worked on and hasn't been looked at. You know, I'm not the scientist. So that's the hardest part is, you know, the scientists can give you all of the exact statistics and, you know, you look at the trial sizes. And I know that, you know, both of the other panelists also were talking about how that education looks. I love the bread example. That's fantastic. And I think that's why it's so important to know your audience and how do you figure that out? How do you know what to say and what's going to resonate with them and what's not? But helping people to understand trials, understand what that size looks like, and understand that data is still being collected. So while our initial trial had over 40,000 people of different ethnic backgrounds, different locations in the world, we still are collecting data from everybody that, you know, reports anything related to that vaccine.
Thank you for that answer. I just can't thank all of you enough. You're speaking to an audience of chamber executives and business leaders who are really curious about how to talk to their employees, how to help their families and their communities. And I think the three of you added a lot to that conversation. So thank you so much for being with the U.S. Chamber Foundation today.
Thank you for having us.
Thank you.
No, it was great. And thank you all for tuning in. Thanks for these great questions. It was really a phenomenal session. If you've missed earlier sessions, you can find them at uschamberfoundation.org or on YouTube. Our next episode will be Thursday, April 29th. You're not going to want to miss it because we're going to tackle reopening the schools. Maybe the most important and sometimes controversial issue that we're coming across at this stage in the pandemic. So we'll see you on the 29th. In the meantime, stay safe, wear your mask, get vaccinated if you can. If you're a business and you'd like to sign up for the Rally for Recovery, you can do so at uschamber.com. We'd love to have you. And I thank you all very much for being with us.